recognize so far what's been going on this evening. Thus far, we've been able to recognize who's in the house. Our members, institutions, our clergy, our guests, our allies, our politicians, and areas are going to be predatory lending, education, and healthcare. Now tonight, you're wondering again what's going on tonight. You heard Matt talk about what was going on, and Matt Hawkins talked about our platform. And you've heard
they had owned their home for 25 years and had only $10,000 left to pay on the mortgage. But the mortgage company would not refinance. They said our friends were not making enough income, and they were trying to foreclose on them. And I thought to myself, how could they not make it possible for these senior citizens to keep their home that they've lived in for so long, that they've poured so much into, and they've paid off nearly the whole mortgage? But then I thought to myself, well, wouldn't it be lucrative to pick up a nice house for that, just for that remaining $10,000? So this couple was trying to pay as much as possible on a mortgage. At the same time, they had no medical insurance. And so they were not making the necessary doctor visits that they had to make. They weren't even buying their necessary medications. And by that, I mean insulin. And we were crying out to God, asking God to make a way for them. And I was determined, personally, I was determined that they would not lose the house that they were so close to paying off. Now, we're a small church with no more than 100.
5 minutes. If reelected, will you commit within 30 days of being reelected to meeting with a representative group of this Connecticut sponsoring committee to begin to work towards strategies to address predatory lending?
Well, I commit. Well, you know, since I pride myself on making every dollar count. And I don't sign any blank checks.
Okay.
But I know there's strength in numbers, and there's a lot of us here tonight. Yes.
We are not jealous. We do not want to take what other people have. We want to get it for ourselves. That is unique, uniquely American. Our founders said that only a moral and virtuous people are worthy of a free society, and the best hope of sustaining a free society is to elect moral and virtuous leaders, not perfect leaders. You don't need to be perfect people, but to try to attain some degree of being moral and virtuous. Now, a free society doesn't have a government that tells you what to do in every aspect of your society. No, our Constitution, which is the blueprint for our freedom, which created the first and greatest free society in the history of the world. That Constitution says in the 10th Amendment, and all of you need to read this Constitution. I'll tell you, it's a lot shorter than the healthcare bill. The 10th Amendment says that whatever power we don't give to the federal government is reserved for the states, and if we don't give it to the states, it's reserved for us, for we, the people, in our personal and in our business lives. The idea was that there would be a pyramid-shaped structure to power, the federal government having a small amount, the states having more, and the people truly having the greatest reservoir of power to make decisions as to what's best for us in our personal and our business lives.
It is indeed a pleasure to be with you tonight. I want to do one thing. I was with George Jepson and heard the question that he was asked, specifically about school systems and learning disabilities and children on the spectrum. Let me inform you that George is committed to children of will stand with this community and any community across the state to make sure that children are taken care of. And with respect to the lawsuit that was referenced in that question, understand that that decision coming from the Supreme Court was sent back to the trial court to determine whether an adequate education is being provided was in a law that was originally brought by a lawsuit in which I was one of the earliest participants and funders of that lawsuit. We waged that lawsuit over a long period of time because these momentous decisions that would impact on whether a state government has obligations and whether it will meet those obligations, unfortunately takes far too long to decide in our system of justice. But I look forward to the day when the trial court will determine that an adequate education has not been provided, in part in many of our urban communities, in part because of how we fund education. So just one fact before I go and speak about the education, the healthcare issue. Understand that 20 years ago, our state funded, from state government to local government, education on par with the other 50 states. We did, on average, what the other 50 states did or do. As it is, our other systems are under as much pressure as they are. This over-reliance on property taxes and this underfunding of the ECS formula, with a particular impact, I might add, in Bridgeport, is the reason that we have these difficulties. And we're going to have to dig ourselves out of this mess over the coming years. I see you're two, but I'm going to take more. I grew up in a family of 8 children. I'm the 7th son and 8th child of Bill Malloy, who was born in 1912 and had a number of careers, and then finally in 1946 started selling insurance. And that insurance agency, along with the amount of money that my mother made, first as a hospital nurse and secondly as a public health nurse and finally as a school nurse, provided for the education of 8 children. But you need to understand this. I grew up in a household where health care and the provision of health care was vitally important. I would come home from school and listen to my mother when she would arrive after me, because we all had to do our homework in the dining room, and my mother would be on the phone in the early 1960s calling doctors to arrange for health care for people in schools, in most cases black and Hispanic children who could not otherwise afford to access health care. My mother would make arrangements with well-meaning and